Hi, I'm Dr. Roland Pagniano, and I'm here with Kayla from the 92.3 FM morning show, one of the best country stations in Columbus, and she's one of our patients too, a wonderful patient. Welcome, Kayla.
Well, thank you. I appreciate it because if you're like me, I was the one who didn't go to the dentist regularly, which I'm sorry, but I'm switching that now because I did have 10 cavities, which you filled, and I had only 2 appointments for that. I mean, I was in and out, no problem, and you also got a new retainer for me, so I appreciate that. And my husband thanks you for the new night guard that I have because if you're like me and you grind your teeth, that's one of the things. And if you're uncomfortable going to the dentist, don't be when you come to Dublin Dental Care. Trust me, from the hand massage that you get when you walk in to you can have Wi-Fi, headphones, anything. I appreciate how comfortable you guys make me.
It's our pleasure, Kayla. Well, thanks again for coming.
Thank you. So when you have a new patient come in, a lot of people can have a missing tooth. What can you do to offer services for that as well?
Well, there are several options we can do, and it all depends on their medical history, health history, and everything, and the quality of the bone and the tissues. But there are several options. One option can be to restore the area with an implant and a crown. And that's one of the best options because it's a tooth, basically like a tooth substitute, and it looks just like a tooth. It looks very natural. Another option is to do a bridge where we have to crown the 2 teeth next to that space and then bridge the space with an artificial tooth. Another option, not quite as good, but still we get a pretty good aesthetic result, is a partial denture. But the drawback with that is that it has a denture tooth and you have to take it out at night, and then put it back in the morning. And if you happen to forget or you break it or something, then you're out of luck and you have to get a new one if it breaks. But those are basically the options. The other option is to do nothing, which doesn't look nice.
Well, speaking of breaking too, some people have come in with either a broken tooth or a chipped tooth. What can you do for that too? Because it is all in-house that you can do.
Right. For a chipped tooth, one of the easiest and quickest things that we can do, and it's really nice and aesthetic, is to do a composite bonding to the tooth. As long as it's not too big, we can do something like that where we bond and mold this material to the teeth, and it's all tooth colored and it blends in nicely with the rest of the tooth structure. So basically you can come in and within about a half hour, 45 minutes, you've got a full tooth again.
So it is wedding season coming up. I already have 6 on my calendar this year. You offer teeth whitening, not only for brides, but if you're looking forward to going to a ceremony too. Or if you just want a bright new smile, you can do that here.
Yes, we have many different options for whitening. One of them is a take-home whitening option, where if you have a little bit of whitening you want to do, but it's not a whole lot, a lot of times you can have that done at home, and you can do that with trays and whitening solution. If you need a little bit more, then you can do an in-office whitening in combination with the take-home whitening to get your teeth the whitest that you want them to be. And then there are others where you got to do a lot of whitening and have really a lot of dark staining or tetracycline staining, and we need to do an in-office type of whitening. And with that, the teeth can get extremely white and very nice, very aesthetic. And it's also good for people that if they feel like, oh, I just don't have the time to do it at home, and I'm not going to be compliant with it, it's going to take forever, then often we'll schedule them for the full in-office whitening. And with that, we can do that within a couple-hour appointment.
Very nice.
Yeah.